Unions and health experts say the KZN rollout vaccine program needs to go off without a glitch, as people are already skeptical about government's capabilities to distribute it. Now, the Johnson & Johnson vaccine in KZN is expected to be given to 2 public hospitals where frontline workers will be one of the first to receive it. Newzroom Afrika's Bonga Dlulane joins us live now. Bonga, very good morning to you. So what's the sentiment from unions and some of the experts you've spoken to?
Good morning, Xoli. Yes, those hospitals we know now are Albert Lituli and also Prince Mshieni, who will be the first ones to get the first part of the 80,000 batch that will come to the KZN provincially. But what unions have been saying, particularly the PSA, let's start there, is that they're very skeptical about this thing because communication between the minister, the MEC rather, Nomagugu Simlani Zulu, and them is lacking about the plans. Logistically is what they worried. They also say they don't want to repeat of what happened with the first vaccine that came from India, only to get here that it can't be used because it's expired or not. So we do know this one has not expired, but they're saying that they've been kept in the dark about exactly what will be going on. Then they need more information to relay back to their members. And the fact that they're in the rollout committee is also something that should tell them that they'll be given more details, but it seems like the health department is not furnishing them with those details, and that they have very, very skeptical, anxious members, who want to know what exactly this vaccine entails. Do they need to be trained in any particular way? Is it 2 doses as the other ones are, inoculations rather, as the other ones they know of? So we have that miscommunication there, and you'd think at a time where unions and also the health officials and politicians need to work together to counter this pandemic, there seems to be this discord, particularly here in KZN, about exactly what's going to happen, when it's going to happen, who's getting it when. Only thing we know is that those 2 hospitals are getting the vaccine, but the timeline, I suspect, will be given tomorrow because the Premier did send out a media alert just before I came on air with you that he'll be meeting with the MECs, he'll be meeting with mayors and traditional leaders to ensure that they talk about the rollout vaccine. So we'll be keeping a close eye on that so that tomorrow when they do give us those details as to what's going to happen with the vaccine. And what health experts, though, have been warning, particularly from UKZN, Professor Mosamo Shabela, saying that there needs to be a way of educating people who already don't want to take the vaccine. So what happened with the last time that it was expired is already giving people who are already anxious even more suspicious attitude towards the vaccine, and said that government needs to be very careful in that point as to educating people who need the vaccine so that we do achieve the herd mentality, if so you will, of the population mentality that we need. So those are part of the concerns, as to when the vaccine does get here, who gets it first is important. Healthcare workers who are risking their lives, but also people need to be convinced again that the vaccine is their best interest.
All right, Bonga Dlulane, let's leave it there for the time being. He is watching the space as the Johnson & Johnson vaccines are expected to land in KZN today.